The MADE method is a technique for revitalizing the face, neck, décolleté area and hands, and is particularly aimed at stimulating the patient's production of collagen and endogenous hyaluronic acid, which leads to greater elasticity of the area treated. The treatment is carried out using a simple technique, which only involves using a file of the product, a 13mm 30G needle, and usually a 2.5 milliliter syringe. In some cases, for example, when dealing with a particularly badly aged face, the doctor may feel it appropriate to add one vial of collagen D6. A 5 milliliter syringe should be used for this purpose. A thorough preliminary examination will enable the doctor to establish the best treatment for the patient. The treatment involves carrying out the infiltrations at the acupuncture points initially and then at the symptomatic areas. The acupuncture points are GB14, gallbladder, located 1.5 centimeters superiorly to the eyebrow arch along the vertical line of the pupil when looking straight ahead. GB1, gallbladder, located 1 centimeter laterally to the angle formed by the outer connection of the two eyelids, upper and lower. TH21, triple heater, located 1/2 centimeter superiorly to the mandibular condyle, anteriorly to the tragus. 4S, stomach, located approximately 1 centimeter laterally to the corner of the mouth. The same points are also found on the left side of the face. For disinfecting the tissues, which should be carried out prior to treatment, it is advisable to use an alcohol-free disinfectant in order to avoid possible irritation from the alcohol. Infiltration of the acupoints is carried out by inserting the needle 3 to 4 millimeters deep. Care should therefore be taken not to insert the entire length of the needle. Here, you can see the exact technique for carrying out the infiltrations. The symptomatic points, which are infiltrated in the same way as the acupoints, to a depth of no greater than 3 to 4 millimeters, relate to the areas that are the most anesthetic, where the drug is required to act more quickly. The tunnelization method is specific to the treatment of facial wrinkles. It involves creating a slight microinflammation of the epidermis caused by the mechanical action of the needle in order to encourage a more rapid relaxation of the tissues. The procedure is carried out by inserting the needle tangentially to the wrinkle, moving it laterally to the left and right, and injecting the drug whilst slowly withdrawing the needle. As with the décolleté area, the reduced thickness of the skin in the neck means that the small wheels technique has to be used. A small wheel is produced by injecting 0.2 to 0.3 milliliters of the drug, which by greatly stimulating the microcirculation enables a better result to be achieved in a short time. It's important to note that only the first part of the needle should be inserted at an angle of 45 degrees to the surface of the skin. Again, as a result of the reduced thickness of the skin, as with the treatment of the décolleté area, the small wheels technique should be used. As with the treatment of the neck, the needle should be inserted at an angle of 45 degrees to the surface of the skin. A final massage with arnica cream reduces the inflammation caused by the microinjections. For patients who don't need treatment on the face, this can also be used to treat just the neck and décolleté area. It is important to support outpatient treatment with an appropriate home treatment. We would advise taking 1 bottle of ARD-Ezilen a day for at least 10 days a month for several months. It is also advisable to use localized treatment with serum vitae at the same time, 1 application on the area of skin affected, morning and evening.